Guys, welcome to my channel. This time we talk about ureter anatomy. So ureter is this is ureter. So we define it. Ureter is the muscular tube that carries urine from renal pelvis to the urinary bladder. This is a renal pelvis. This is a urinary bladder. Length is the 25 to 30 centimeter long. Diameter is the 3 to 4 millimeter. Location is the retroperitoneum. It begins renal pelvis and end urinary bladder. Parts of the ureter: abdominal party, pelvis party, and intramural party. When we talk about ureteric constriction, the first construct is the uteropelvic junction, pelvic brim, and uterophysical junction. We can talk about another time in the end of the video when we talk about in clinical correlation, because this is the where the stone is in when having ureteric or kidney stone. So we talk about course. So from renal pelvis descending to the anterior psoas major. This is psoas major. It crosses pelvic brim at the bifurcation of the common iliac artery and enters the pelvis. But so where this is where the bifurcation of common iliac artery, and this is where the pelvic brim enter. So passes obliquely through the bladder wall. It opens to the urinary bladder. You see it obliquely to the urinary bladder. So we talk about relation of the right ureter. So anteriorly, duodenum, terminal part of the ileum, the right colic and the ileocolic vessel, and the right testicular or ovarian, testicular in male, ovarian in female, and the root of the mesentery of the small intestine. Posteriorly, the right psoas muscle, the bifurcation of the right common iliac artery. And this is a left ureter relation. Anterior, the sigmoid colon and the sigmoid mesocolon, the left colic vessel, and the left testicular or ovarian vessel. Posteriorly, the left psoas muscle and the bifurcation of the left common iliac artery. Medially, inferior mesenteric vein. So we talk about a blood supply. So the ureter is the three parts. The upper part is renal artery, supplied by renal artery. Middle part is supplied by ovarian in female artery and testicular in male artery. Lower party supplied by superior vesical artery. So venous drainage are the same as the artery. So lymphatic drainage drain into the lateral aortic node or iliac node. So we focus something in relation when we talk about, and this is important, in male ureter crossed by ductus deferens near the bladder. In female, it crosses under uterine artery near the cervix. You need to remember this. This is so important. Don't forget it. I know your professor love this in exam. So we talk about a clinical correlation. The first is the ureteric stone, kidney stone that moves into the ureter. So when we talk about constriction, this word in stone is in. Another clinical correlation is the hydroureter. What's the hydroureter? It's the dilation of ureter due to the obstruction of urine flow. What can cause it? Enlarged prostate, tumor, ureteric stone. Another clinical is the vesico-ureter reflux. This is so important. Because urine flows back from the bladder ureter to the kidney. Normally urine come from the kidney to the ureter to the bladder. So what happened physical ureter reflex? Urine come from bladder, come back bladder to the ureter to the kidney. Cause is incompetent utero physical congestion.